My name is Dr. Timothy Quinn, and today I want to share two experiences that really just made me feel yes. Both patients came in for their 6-month follow-ups. Okay. Now they've been coming every month for the last 6 months, but I consider 6 months, that's like the time that we really look at the success. Both patients came in 6 months ago, and both patients shared with me that they wanted to get healthier. Okay. Now, the first patient, he was a truck driver and he had a BMI of about 44. He was an individual living with obesity. We connected right away. We're both too old, Al Bundy, football stars in our mind, but we really weren't. Well, maybe he was, but I was terrible. But I was on the team. And we talked about the good old days and how we would go to practice and work out. And he said, Doc, I tried to relive it. He said, I went and, got some workout clothes, and every day when I wasn't on the road with the truck, I would exercise. And even when he was on the road, he would share, he'd go to the rest stations and he'd walk and exercise, and he would try to eat healthy, but he just couldn't fight those urges. But the end result was, he shared that he had tried diet and exercise as much as he could for 1 year with little to no success. So we talked about different medications that could help him get to that healthier weight. And we arrived at Wegovy, and his insurance covered it. We had to apply for it through the pharmacy. It got denied. We got a prior authorization. We filled it out, and he was approved. So 6 months ago, he started his journey. He started out with the lowest dose, 0.25. And Wegovy, that's from that new class of medications, the GLP-1 agonists. And basically what they do is they help you. So when you start the medication, you do an injection once a week. It makes it so that when you eat, you have slow gastric emptying, but you get full really quickly. So if you normally eat, let's hypothetically say a 12-inch, as he would share, he would eat from Subway. You might eat maybe 2 or 3 inches and you're full. And when you get those urges later in the evening, they don't come anymore. So you find yourself eating significantly less, resulting in weight loss, as he did. So we started out with the 0.25 for a month. Then we went to the 0.5, then the 1, then the 1.7, and then the 2.4. And the reason for that tapering is to decrease the possibility of side effects, which in a lot of cases could be irritation to the stomach. But doing it that way, we're able to assess it and we can progress as he tolerates the medicine, and he did. Now, at the end of 6 months, he had lost 52 pounds. Not only did he get to a healthier weight, his blood pressure was better controlled, his cholesterol was lower. He started out with a lot of joint pain, but he told me, he said, Doc, I can move now. He told me he no longer had as much joint pain, and he was exercising even more. And he said, Doc, I just feel better about myself. And he said, my wife, she's feeling me too. So we had to, all right. So let's talk about the next patient. She came in 6 months ago and she had poorly controlled diabetes. She said, Doc, I want you to help me get better control of my diabetes. So we used a scenario. We looked at different medicines, but we chose Ozempic. Now, it's from the same class, those GLP-1s, but it's the same ingredient as Wegovy. The weight loss medicine is made by Novo Nordisk, is semaglutide, and because it's the same ingredient, the semaglutide, the active ingredient, she was able to use it, and over the course of the 6 months, she was able to get her diabetes much more controlled, but she lost weight as well because it has the same ingredient. So we have two people that got to a healthier weight. They're both telling me they feel better about themselves, and their medical conditions are better controlled. One, blood pressure, cholesterol down, the other, diabetes, and all her other medical conditions are better. Both people are better. Now, in addition to considering weight loss medication or medications that can help you with your weight, you also want to include a healthier exercise regimen. And in closing, I want to offer that my wife, and I want you to stand up, Melissa, wherever you are. That's right, I'm watching you. I have cameras in the ceiling. My wife has information about our free walking program every Saturday morning at the North Park Mall at 9 a.m. You can come out. It's sponsored by the Mississippi Obesity Society. She'll give out information. But just know that if you are somebody out there that wants to get healthier, that wants to get to a better weight, talk to your medical provider about medications that can help you reach this healthier weight, this healthier status, and just be the best person that you deserve to be, the best version of yourself. Thank you.